Hello everybody, my name is Hamad Javed. I'm part of the Biomechanics Laboratory at the University of Kansas, and we are researching the effects of free leg movement on single leg forward and backward hopping performance. ACL injury is some of the most common knee injury in sports, and patients undergo ACL reconstruction surgery, after which knee function assessments are undergone, which assess things like their eligibility for a return to sports. These assessments are based upon the distance they can jump during single leg forward hops. However, prior research has found that these assessments are inconsistent, this being due to movement that occurs during these jumps by the free leg, which overcompensates for any underperformance of the knee. This can result in inconsistencies during clinical practice, and additionally, single leg backward hopping is actually found to be more mechanically demanding on the knee joint, and its utilization during these assessments can prove useful alongside single leg forward hops, which is what we do during our research, which is aimed to quantify the effect of free leg movement on hopping performance during single leg forward and backward hopping. We hypothesized that free leg swings enhance hopping performance for all conditions, and oppositely, constraining the free leg swing lowers hopping distance for all conditions. And these results should indicate that if we standardize or essentially control the constraints on the free leg's movement during these jumps, it can increase the accuracy of these assessments. Going to the research, in our methods, we have used 30 participants, all performing these single leg forward and backward hops for these tasks. And for this task, they underwent three conditions. The first condition being a free swing of the free leg, and is allowed to move naturally. The second condition is a self-constraint of the free leg, where the free leg is held at 90 degrees flexion of the hip. And a third condition where the same thing as the second, where the leg is held at 90 degrees flexion of the hip, but this time held with a supportive L frame made of plastic, held strapped to the leg to hold it in a fixed position. And the measurements of all the distances jumped are done with tape, and resultingly, we can see that in gray, blue, and green, respectively, the free swing, self-constrained, and mechanical constraint conditions, that the free swing condition allowed for the greatest distance traveled, while full constraint of the leg with the L frame allowed for the least amount of distance travelable. This emphasizes importance and specifications for consistent task execution during these assessments. Furthermore, we can understand that stabilization of the free leg did decrease performance, but in doing so, it was done with the fact that there was an elimination of all chances of compensation of the movement by movement from the free leg. Essentially, conclusively, we can see that the free leg swing significantly enhances hopping performance compared to the other two conditions. And these findings emphasize that there's an importance of consistent task execution when we undergo these single hop tests in clinical settings. And standardizing and controlling and constraining the free leg's movement can improve the accuracy of performance-based assessments following ACLR. Further studies will have to investigate lower limb biomechanics across all different types of constraint conditions for the free leg and understand and quantify the mechanisms that occur and allow us to understand the differences between performances. Thank you for listening.